Universal Hospital Services is pleased to present the following in-service of the Air 1, Air 2, and Arize therapy surfaces. All three surfaces are designed to provide wound prevention for patients with skin integrity issues and wound treatment for pressure ulcers up to stage 4 for patients with active wounds. They feature two therapies, low air loss and pulsation. We will describe both of these therapy options shortly in more detail. As you touch any of these mattress surfaces, you will notice it is made from a two-way stretch nylon material, which helps to reduce shear on the patient's skin. These mattresses also feature safety straps to hold the surfaces firmly in place. The Air 1 includes the addition of elastic straps at the foot and head end to firmly attach the overlay to an existing foam mattress. The Air 1 is a 5-inch thick mattress overlay solution designed to sit on top of an existing mattress. It is a cost-effective solution for adding low air loss therapy when you already have a foam mattress in place. The Air 1 supports patients up to 500 pounds. The Air 2 is a mattress replacement system that utilizes the same controller as the Air 1 with the added features of care rails and a patient position sensor to augment therapy and further support wound prevention programs. The Air 2 has a mattress depth of 8.5 inches. Care rails, positioned around the perimeter of the mattress, provides 2 inches of additional air cell support, which helps provide a gentle awareness of edge, aids in proper positioning on the surface, and helps prevent limbs from resting against the side rails. To activate the care rails, turn the knob, located on the hose, toward inflate. To release the air and deactivate the care rails, turn the knob toward deflate. The Arize 1000EX, with a weight capacity of 1,000 pounds, is designed to meet the specific treatment needs of bariatric patients. The mattress features inflatable width and length air bladders that can be customized to each individual patient. These expandable bladders facilitate easy transport of the patient when moving through narrow spaces and through crowded corridors. The length is expandable from the standard 80 inches up to 88 inches, while the width accommodates expansion from the standard 36 inches through 42 inches and up to 48 inches. As an added feature, the side air bladders can be adjusted independently or simultaneously by turning the control knobs located on the side of the mattress. The knob on the lower left controls the length extendable bladders. Like the Air 2, the Arize features care rails, which are controlled by the lower right knob. Beneath the air bladders of the Air 2 and Arize 1000EX is a 2-inch layer of foam to help protect the patient in the event of mattress deflation. The Air 1 and Air 2 share the same pump and user interface. The Arize 1000EX pump, although slightly different in appearance, features the same controls as the Air 1 and Air 2 controller. For the remainder of this in-service, we will utilize the Air 2 mattress and pump. The pump control panel features a number of adjustable settings for patient comfort and therapy, and also supports caregiver needs. These include auto-firm, therapy mode, pulsation, and patient comfort adjust. We will go over these features shortly in more detail. To turn the pump on, press the power button. Pressing the power button again will turn the pump off. When the on button is illuminated, the surface has full power. After 12 minutes of inactivity, the control module will lock all features and the on button will flash green. This feature helps prevent accidental or unwanted changes to the therapy provided. To unlock, simultaneously press the comfort adjust up and down arrows. Caution should be used when unlocking the pump. While it is possible to unlock the pump by pressing the power button twice, using this method will cause the pump to reset back to the default settings of therapy mode and comfort level 5. This may not be in the best interest of the patient's needs or comfort and should therefore only be used when setting up the mattress prior to patient use. The auto-firm, therapy, and pulsate settings can each be activated by pressing the mode button. A light will appear next to the therapy mode that you select. Auto-firm, also known as max inflate, increases airflow into the mattress. This creates a firmer surface to facilitate patient egress, repositioning, and transfers to and from the mattress. When the auto-firm feature is no longer needed, be sure to manually adjust the pump settings back to the desired settings for your patient. If left unattended for 12 minutes, auto-firm will discontinue and the pump will revert back to therapy mode and comfort adjust level 5. The therapy mode setting engages the low air loss feature, which initiates airflow through the coverlet, helping to keep the patient's skin cool and dry. Low air loss therapy is delivered through the mattress to 3 areas, 2 outer sections and a center point, ensuring the therapy is provided throughout the patient's body. Pulsation mode provides 2 therapies in one. When pulsation mode is selected, low air loss therapy continues and pulsation therapy is initiated. Pulsation therapy provides a gradual up and down movement of the air bladders, helping to improve capillary flow. To accommodate heavier patients and to assist in patient comfort, you can press the up and down arrows to manually adjust the firmness of the mattress. The system default setting is level 5. A higher number will result in a firmer mattress, and a lower number results in a softer, more contoured feel. Higher numbers should be considered for heavier patients and lower numbers for lighter patients. A patient position sensor is included as a feature of the Air 2 and Arize. It automatically detects the head of bed angle, adding more airflow to the sacral area when the head of bed angle reaches 28 degrees. This feature helps assure adequate therapeutic support when the patient is in the Fowler position. The position sensor light will illuminate on the control panel when this feature is active. The sensor cable must be connected to the surface and the controller for this feature to work. The CPR release for the Air 1 and Air 2 is located where the mattress hose connects to the pump. It releases when the pull tab is lifted up. This will cause the hose to detach from the pump and the mattress will begin deflating rapidly. The Arize 1000EX CPR release is located at the same position. It is operated by pressing the buttons on each side of the connector and pulling down to disconnect the hose from the pump. Finally, the pump will sound an alarm in the event of power loss or if the pump's power cord is unplugged. To temporarily silence or reset the alarm, press the Alarm Reset button and then address the power issue. In summary, the Air 1, Air 2, and Arize 1000EX are top-of-the-line air supports. The Air 1 and Air 2 feature a 500-pound patient weight capacity, while the Arize 1000EX features a 1,000-pound patient weight capacity. They all feature low air loss and pulsation therapy and are designed to provide wound prevention for your patients with skin integrity issues and treatment of pressure ulcers up to stage 4.